In this module, we will be discussing the pre-op diet, which is a special diet that you will follow 2 weeks before your surgery date. This module will review the pre-op diet. The following module will go over the post-op diet and how to complete the menu assignment homework. Before we jump into the pre-op diet, let's take a few minutes to review some of the habits that you've learned so far that will help you be successful before surgery and after surgery. Remember to drink 64 ounces of fluid a day, avoiding caffeinated, carbonated, alcoholic, and sugary drinks. Remember to practice separating your beverages from your food. Eat 3 meals a day. Include 2 healthy snacks, if hungry, in between meals. Include lean protein with each meal and snack. And remember to eat your protein first at meals and snacks. Practice mindful eating. Sip and eat slowly, chew your food well, avoid distractions while eating, and avoid grazing. Begin a physical activity or exercise routine. Start taking a complete daily multivitamin and complete any pre-operative lab work that the surgeon has ordered for you. So you might be asking yourself, why do I need to complete a preoperative diet? Well, some of the benefits to completing a preoperative diet include shrinking the size of your liver, which makes it easier, safer, and quicker for the surgeon to complete your surgery, and it helps you lose a little bit of extra weight right before your surgery. Starting 2 weeks before your surgery, you will follow the diet we are about to discuss as outlined. Remember to drink 64 ounces of fluid a day and continue taking all of your vitamins as recommended. All right, so first let's discuss the meal plan. You will follow this meal plan every single day for the full 2 weeks that you are on the pre-op diet. So for breakfast, you can start off with a protein shake. It should be less than 200 calories and have at least 20 grams of protein per shake. Mid-morning, if you're feeling hungry, you can choose to have a snack. The snack list is listed on the next slide and also in your patient handbook. For lunch, you can have another protein shake. Again, it should be less than 200 calories and have at least 20 grams of protein per shake. Midday, if you're feeling hungry, you can choose to have another snack. For dinner, you may choose between a homemade meal or a frozen meal, which we'll discuss later on in this presentation. Next, let's review the snacks that are allowed while following the pre-op diet. You may choose to put snacks in between your meals if you're feeling hungry when on the diet. Below are the list of snacks that are acceptable. I will give you a few minutes to review the list and maybe think about which snacks you would enjoy when following the pre-op diet. Feel free to screenshot this slide or refer to your patient handbook if you need to review the list again. Next, let's go over the dinner meal options. There are two different options that you can choose to have for dinner while following the pre-op diet. Option 1 is a homemade meal. This includes 3 to 5 ounces of lean, high-quality protein with unlimited non-starchy vegetables, which excludes peas, corn, potatoes, and winter squash. Remember to use portion control with added fats. Use no more than 2 tablespoons of low-fat, low-calorie dressing, no more than 1 tablespoon of oil for cooking, and no more than 2 tablespoons of grated cheese for meat or vegetables. Option 2 would be a frozen meal. This can be a great option if you're feeling rushed or don't have time to prepare a meal at home. They should be less than 300 calories and at least 15 grams of protein. Check the label to make sure that it contains less than 600 milligrams of sodium. This will help you from retaining any extra water. You may pair the frozen meal with free food or additional non-starchy vegetables. Next, let's discuss how to choose a healthy frozen meal when following the pre-op diet. Below are two healthy choice meals. One is the Cressel's chicken pot pie, and the other is the sweet and sour chicken. If you look at the bottom of the package, you can see a shortened nutrition label, which can help you determine which meal might be appropriate to choose when on the pre-op diet. I'll give you a few minutes to take a look at the shortened label and compare it to the criteria for a healthy frozen meal. All right, let's discuss. So if you look at the Cressel's chicken pot pie, it has 280 calories, 600 milligrams of sodium, and 18 grams of protein. Meanwhile, the sweet and sour chicken has 350 calories, 590 milligrams of sodium, and 12 grams of protein. This means that the Cressel's chicken pot pie would fit the criteria for a frozen meal on the pre-op diet. However, the sweet and sour chicken doesn't meet all of the criteria, so this one we wouldn't want to choose. Below is the list of free foods that are allowed on the pre-op diet. You can supplement these foods into your pre-op diet meal plan as desired. These foods contain little to no calories and therefore can be supplemented freely and as desired if you're feeling hungry. I'll give you a few minutes to review the list and think about which foods you might enjoy while following the pre-op diet. You can screenshot this slide or refer to your patient handbook if you need to review the list of free foods again. Below is a list of condiments that are allowed on the pre-op diet. You can use these condiments as you would like to help add some flavor to your food and make it more enjoyable. I'll give you a few minutes to review the list of condiments and figure out which ones you might enjoy while following the pre-op diet. Feel free to screenshot this slide or refer to your patient handbook if you need to review the list of condiments again. All right, so you have made it to the end of your preoperative diet. On the day before your surgery, you will have no solid food to eat, but you can have up to 5 protein shakes. On the day of your surgery, you will have nothing to eat or drink unless specified by a member of your care team.